All right. Hypertension after renal transplant is likely related to what activation? Renin-angiotensin system activation. Relative risk greater than 1 indicates what? Increased risk. Relative risk less than 1 indicates what? Uh, Decreased risk. Pseudoparalysis, poor feeding, irritability, and aversion to being held are signs of what in a child or baby? Septic arthritis. Note, you should definitely empathize with your patients. And also note that there are times when you need to report a patient, right? Harm to self or others for the most part. If you suspect a paradoxical embolism, what sort of imaging should you get? Transesophageal echocardiography. How do you treat influenza? With acetaminophen and symptomatic treatment. True or false, hydrochlorothiazide can cause photosensitivity reactions. That's true. Hydrochlorothiazide can cause photosensitivity reactions. If kids suddenly start acting weird and bad, what should you suspect? You should suspect child abuse. If a fetus is in breech, you can try external cephalic version when? 2 weeks prior to delivery. And if need be, formally assess a patient's decision-making capacity under obvious situations. What medications are first-line treatment for panic disorder? SSRIs. And also note that major depression obviously can be treated with medications. First line for that is SSRIs. Population level information is what ecologic studies uh, use, not individual level information. What is the primary treatment for renal cell carcinoma? A radical nephrectomy. How do you treat a baby with GERD? How do you keep them from having GERD-like symptoms? Keep the baby up after feeding. What can be used to diagnose primary biliary cholangitis? And the clue is it's in the serum. Anti-mitochondrial antibodies. And how can you treat primary biliary cholangitis? Ursodeoxycholic acid can be used to treat primary biliary cholangitis. The greatest risk of PBC, by the way, is osteoporosis and osteopenia. And regarding melanoma, you got your A, B, C, D, E. Those are the things to look out for. And what do they mean? Asymmetry, border, color variation, diameter, and evolving. Asymmetry, border, color, diameter, evolving, right? And how do you treat, basic melanomas for the most part? What sort of biopsy? An excisional biopsy. If you suspect scabies in a patient, what sort of technique should be used to get the sample that's going to be assessed later? Skin scrapings, right? And in general, how do you treat scabies? 5% permethrin cream. A transthoracic echocardiogram should be used to diagnose a patient with acute right-sided infective endocarditis, by the way, right? You suspect infective endocarditis, get a transthoracic echocardiogram. What's the first line medication to treat depression? SSRIs. How do you treat cerebral venous sinus thrombosis? Low molecular weight heparin is a good start. If you have a pregnant female and you want to test to see if she has gestational diabetes, what diagnostic tests would you use? A glucose tolerance test. A mom with gestational diabetes mellitus needs to get insulin in order to decrease what side effect for the baby's shoulder? shoulder dystocia, right? If you suspect appendicitis, you should get what sort of imaging? A graded compression ultrasound. What is a complication of untreated appendicitis? Phlebitis. What p-value is statistically significant? Less than 0.05 or less than or equal to 0.05. If you suspect sarcoidosis, what imaging should you get? You should get chest radiography, like a chest x-ray for the most part. If you're trying to diagnose cancer and the person has, abnormal lymph nodes or lymphadenopathy in certain regions, does it make sense to go to that sensitive, delicate, cancerous area that has all these veins and arteries and blood flow and nerves, and it's right next to the lung? You might cause a pneumothorax. Should you go there, or should you go there to the lymph node to get the biopsy? Go to the lymph node, right? Why make things difficult? If it's at the lymph node, you already have your stage, at least, right? You can get a pathologist to read it, and they know what it is. They know everything. If you suspect osteonecrosis in your patient, what imaging modality is most helpful? An MRI. And stage 4 osteonecrosis, by the way, if that was at the hip, you would need a total hip replacement. When you're dealing with your patients, empathize with them and respect their wishes for the most part. For detached limbs, how do you want to inform a patient to bring it to the emergency room so plastics or whoever can stitch it back on? Wrap it in gauze, moisten it with saline, place that in a sealed sterile bag, and then place that bag in another bag that has ice water for the most part, right? That should go in a container with ice mixed with saline, or maybe like water with ice or whatever. And what sort of patients with a genetic blood issue are at increased risk of osteonecrosis? Sickle cell patients, right? Sickle cell patients are at risk of osteonecrosis.